I am Dr. Vinay Chandrashekar, consultant pediatric surgeon working at Narayana Health, Bangalore. Today, I will be talking on one of the common congenital problem seen in children called hypospadias. Hypospadias is essentially an abnormal opening of the urinary passage. It generally opens below the tip of the penis. It can be very mild degree to very severe degree, depending on where the opening of the urethra. So essentially, this is one of the commonest conditions seen in boys. Almost you see 1 in 150 to 200 male children. The surgery for this is done during 1 year to 2 years. These children can also have associated other anomalies like undescended testis and other congenital problems. So these children usually present with passage of urine from the undersurface of the penis, and they can have a severe degree of bend in their external genitalia, or that's the penis. Surgery for this condition is generally recommended at the age of 1 year. So for the past 10 to 12 years, we have got a large experience with this condition with the excellent outcome. So surgery, either if it is a very simple one, can be done in one stage. If it is very severe degree, it has to be done in 2 stages. And over the past several years, we have had a good experience with this condition with the success rate of more than 95%. And whenever a child has got this anomaly, one has to see a pediatric surgeon who has got special interest in this particular condition to be able to get a better results. Thank you.